My name's Peter. I own a restoration facility in Boca. I'm 40 years old. I am happily married. We have 3 dogs, and I really enjoy cycling. I would say that I'm a pretty avid cyclist. I usually bike every day. If it's not pouring out or something like that, it'll be anywhere from 20 to 30 miles a day. I do anywhere from 200 to 300 miles a week. And then towards the weekends, we do a lot of larger group rides where there's 40, 50, 60 guys. That particular day, I was out with a normal group ride, a little bit larger one, a little bit safer one with more people. And I was like a little bored. So like on the way home, I met another group. Long story short, I got tangled with a guy and I went over my handlebars right on my shoulder, and it ended up flipping a couple times. And then there was a guy that ran me over. It was a debacle for sure. And then I just kind of laid on the ground there for a little while, and the ambulance came, and my wife came, and we ended up going to Bethesda right after that. We got in the bed, and he met us kind of right away.
I remember Peter when he came in. The emergency medicine resident saw him first with me before I went in and assessed him. He was incredibly lighthearted about the injury at that time. He was taking it very well. I spoke with him for several minutes and embraced the mood that he had and tried to reflect that back. He was offered, medication to help him with his pain. And we talked together about what we were going to do to assess his injury.
He was just really nice, really welcoming. And, I was my shoulder was in 4 pieces. So it was I was trying to do my best to laugh it off and stuff. And he was just, it just made a very comfortable experience. It was nice.
I recall later his wife came in and she was understandably a bit more distressed about the situation. So I spent more time at the bedside speaking with her and him and trying to ease their concerns about what would be happening next.
I was very grateful to have such a good experience there. And Dr. Taylor was just super nice, and it was okay, well, we're going to get you taken care of. And it was we walked out of there kind of surprised. We walked out of wow, that's really weird, how cool that experience was.
When someone goes out of their way to thank us for the type of care we delivered, it certainly gives us some energy moving forward to keep doing what we're doing and be motivated to keep treating patients in the best possible way.
Yeah, I actually feel really, really good. For having such a fresh surgery, I feel great, really good. So probably after this is 100%, I can really have good range of motion and stuff, then we'll go back. I expect another 3 or 4 weeks for sure.
We were very happy that we could provide Peter with the best care that day. We do have very advanced capabilities at Bethesda Hospital to take care of all types of medical conditions. And we are very much looking forward to our upcoming emergency department renovation, which will help to modernize our facility and give us the ability to deliver even more updated and advanced medical care to our community members here at Bethesda Hospital. As we emerge from this pandemic, the emergency department renovation will help us to meet the needs of our community as we face that challenge.
I would recommend it to anybody for sure, especially with Dr. Taylor.